Hi, this is Sarah Berga, and I am here to present a small talk on COVID-19 vaccination and reproduction, and we will focus on pregnancy, lactation, and fertility. I'm at the Jacobs School of Medicine and also at Oshai Children's Hospital, part of Kaleida Health, and it's my privilege to talk to you today. So, quick summary for those who just want the high points. Vaccination is safer for all aspects of reproductive function than getting COVID-19 infection. And men and women seeking to conceive or who are undergoing fertility care should get vaccinated. Women who are currently pregnant should get vaccinated. Women who are breastfeeding should get vaccinated. And yes, we need more research to determine the impact of COVID-19 and vaccination on eggs and sperm, particularly for those undergoing fertility preservation. But we really don't think there's any reason not to get vaccinated, even if you're in a high risk group. So clinicians need sound bites to confidently convey this information, but we also need everybody in the general public to understand exactly how safe it is to get vaccinated. So a lot of people have been asking me, could I hurt my fertility by getting vaccinated? And that's a good question. You always want to safeguard your fertility. And they sometimes say, I'm trying actively to get pregnant. I might be going through IVF. Should I get vaccinated? And the answer is yes. Please get vaccinated. And if you have the option, get vaccinated before you go through infertility therapies. But if you're just trying to get pregnant and you can't postpone that, still get vaccinated. So, in the middle of the front part of the pandemic, we closed our fertility services all around the United States in compliance with local guidelines and also our national guidance. So the national organization is called ASRM, and we had a group of people that got together and said, golly, let's just close until we know how safe or unsafe COVID-19 is for pregnancy. And this is a large number of people. About 300,000 cycles are done in the United States every year, and that is just the tip of the iceberg for infertility and fertility. So what we found is that people did not want to postpone their care, and they were taking the risk of trying to get pregnant in the middle of the pandemic, even during the very peak of the pandemic. People have been trying to get pregnant both in last spring and even recently. So we know that people are not going to postpone their infertility care if they don't have to, and there's lots of reasons why they should not. That's why we'd like them to get vaccinated. Now, let's just talk about reproductive function for a minute. You can't wait forever to get pregnant. Eggs actually have a timeline, and by age 38 to 40, we are starting to run out of eggs. And it's unusual and difficult sometimes to get pregnant after age 42. So there is a finite timeline, and we don't want people to have to wait forever. So how we get out of this really right now is to make sure that people get vaccinated. We have worried about the vaccine itself, but we worry much more about what the COVID-2 or COVID-19 pandemic will bring to our endocrine system. So it's hard to get pregnant if you're sick. If you get COVID-19, a lot of endocrine consequences can result, including reproductive impairment. So think about that and then think about the vaccination. It's far safer to get vaccinated. We particularly worry about men. Men sometimes think they're not part of the story, but we know that people who get sick actually, particularly men who get sick, sometimes have an impairment in their reproductive function that lasts far longer in men than in women. That's because it takes about 90 days to make sperm. And so if you get really, really sick, the sperm production will be actually decreased for a while, and it may take a while to get back to normal. So here's where we are. ASRM, National Task Force, actually international group, recommends getting the vaccine whenever you are able to do so. And because these are not live viruses and are not thought to increase the risk of infertility or first or second trimester loss, stillbirth, or congenital anomalies, If you are contemplating getting pregnant, please get vaccinated. What about if you are pregnant? What should you do? And we know that we want healthy babies and healthy moms, and healthy babies have to have healthy moms. So it's hard to have an unhealthy mom and a healthy baby. What we have found is that there are a lot of people who are pregnant all the time. Sometimes they know and sometimes they don't quite know, but there are a lot of potential candidates for getting the infection COVID-19, and we very much like to not have that infection happen to pregnant women. So, in many ways, it's a vulnerable population, and we do not want to withhold care from people who are pregnant. And in fact, that is our main goal. If you are pregnant, get care as soon as possible. And if you think you have COVID, get diagnosed as soon as possible. And if you can get vaccinated as soon as possible because we don't want to find ourselves trying to rescue you and a baby at the same time. It's actually an increase in risk for mom and baby if you do get COVID-19. It doesn't mean that we can't do something about it, but it means that it's harder and there is more risk. So, because these vaccines are not live viruses, at least the two that we have now, we think they're perfectly safe. The newly, soon to be approved, we hope, AstraZeneca vaccine will be using a deactivated adenovirus, and at this moment it's not available. So, how does an mRNA vaccine work? So that's actually a little bit complicated for people to understand. What does the M stand for? Messenger. What is RNA? It's a copy of DNA that circulates. And when we put a little piece of this message in your body, it makes the protein that goes along with it. So we are making antibodies that will attack the viruses, and in this case, it's directed against COVID-19. So, where we are right now is recommending vaccination to every pregnant woman. And if you are nervous, it's understandable. This is a big step. You don't want to hurt your baby. But if you get COVID-19, it really is a much worse step. So, what about if you have a baby and you're lactating? Can you get vaccinated? And the answer is yes. You might see a theme emerging here. Actually, we don't think there's any risk if you're lactating. You may feel a little bit like you have a sore arm, but I think you can probably breastfeed with a sore arm. So that might be the biggest risk. But there's no reason from a medical point of view not to get vaccinated. So we've got this little infographic that was presented by a nearby institution, and essentially what we are trying to convey all across the United States, and we are in complete agreement. The American College of OBGYN has once again, as of yesterday, endorsed COVID-19 vaccinations in pregnant and lactating women. And we go through these risks here to say, yes, there is a risk of injection site um, sort of pain, and it will hurt for a day or two, fatigue, headache, maybe some muscle pains, chills, joint pains, and a small percentage of people will get a fever. So there is a little risk that you won't feel quite right. And you might want to plan for that in terms of taking some time off, but it's still safe. So if you do get vaccinated, we want you to also then report yourself to the federal government so we can collect more data. And this is the site for doing that. It's run by the CDC. So what did I say? This is just a can opener to get you to ask questions. But vaccination is safer for any stage of reproductive function, before, during pregnancy, and after. Both men and women who are seeking to get pregnant should have, and who are undergoing infertility care should get vaccinated. And if you are currently pregnant, you should definitely get vaccinated. If you're lactating, it is perfectly safe to get vaccinated. And yes, we do want to do more research on this. So if you do get vaccinated, please help us by reporting how you do. But again, please take care of yourself so you can take care of your family. Thank you. Great. So there are some questions, and I'm going to start and let me just read them. So the number one was, is it safe to get vaccinated while still breastfeeding? Will antibodies make it to my baby? We don't know yet. But if they do, that would be a good thing. Sometimes breast milk does have antibodies. And even if it doesn't have antibodies to COVID-19 after you get vaccinated, it will still have other good antibodies. So don't stop breastfeeding if you get vaccinated for COVID-19 or any of the other vaccinations that we recommend. I'm the mother of two teens. Is it possible for them to become sterile if they get the vaccine? No, it isn't. Um, in fact, we always think that viruses pose a threat, and they do, to fertility. It's rare. Even viruses rarely permanently affect fertility. But this is not a virus. In fact, this is an antidote to a virus. So this is preventing that risk by giving our body a chance to make antibodies against a known what we call pathogen that we know is really harmful. So why wait to find out that the virus causes fertility problems? It's far better to get vaccinated and know that you will be at least partially protected no matter what the variant that's circulating. Is it true that you should avoid getting pregnant for 2 months after receiving the vaccination? Definitely not true. In fact, if you are contemplating pregnancy and you are undergoing any kind of therapy or just trying at home, you should get vaccinated first. It's always better to get vaccinated before you get pregnant. Um, so if you had to say when is the optimal time to get vaccinated, it's fine to get vaccinated while you're trying to get pregnant, and that is always going to be preferable to getting vaccinated when you are pregnant. Because again, we would rather have you enter pregnancy and be safe and healthy when you start your pregnancy than wait and take the risk of getting this pandemic virus. If I get the vaccine while still breastfeeding, could it have an adverse effect on my baby? I mean, sometimes if you don't feel well, your milk supply goes down a little. But if the baby suckles at regular intervals and doesn't quite get enough, when you recover, you will recover your milk and you will be able to feed your baby. So it should not pose a risk. I know that when you're breastfeeding, your energy level is sometimes lower because it takes a lot of energy to make milk. And so you might need to eat a little more, or you might need to rest a little more to kind of keep up with the metabolic demand of one, making antibodies, and two, making milk. So you do have to take care of yourself and remember that what you're doing is a highly energy dependent event and plan accordingly. The CDC and the World Health websites are suggesting pregnant women not to get vaccinated. That is true. And we are working with them to have them change because the American College of OBGYN actually thinks that pregnant women are a high priority group. Now, we can't make the case for that at the moment because there's a shortage of vaccine. But if there were an ample supply of vaccine, we would definitely ask women who are pregnant to go and get the vaccination as soon as possible. So please don't delay. I'm sorry there's some confusion. There often is as we sort of sort out how we're going to get things done. And then, as you know, this is not a trial run. This is the real thing, and we weren't planning it. So it's here, and we have to respond accordingly. That means that we don't know everything we need to know all the time. That should not frighten you. Um, what we want is to not have people get the virus. More people get the virus, more mutations result. The more difficult it's going to be for all of us for longer. So I think not only from a personal point of view, but from a societal point of view, we want to get as many people vaccinated as soon as possible. Any concerns about future pregnancies? I can't think of anything better to protect your future pregnancy health and your own future health than not getting COVID-19. This is a really tough virus. And even if you don't get sick, you still might have consequences. So let's not get sick. That's our really best strategy. And while we have something that we can take, let's take it. And we'll go from there. But that's the lesser of the risks for sure. So if you've gotten your first dose and you're awaiting your second dose and you get pregnant, congratulations, you should be perfectly fine. We all think the second dose for some people is a little bit more of a reaction, but again, that just tells you that your immune system is active and doing its job. You know, the early part of pregnancy, the first couple weeks actually are really a fine time. If you're trying to get pregnant and you get pregnant, there shouldn't be any real impact. Um, and, and in fact, that's why we're making such a strong case for that. So, where we are right now is with a shortage of supply of the vaccine. And I think that's why when your time comes up, if you can get it, you should. That's really the safest thing to do. Thank you. Good to be here.